What if Africa no longer needed Western aid to build world-class hospitals? What if, instead of waiting for foreign loans, an African nation funded its healthcare revolution without a single cent from the IMF or World Bank? It sounds impossible, right? But it's happening right now in Burkina Faso. While other countries struggle under mountains of debt, Burkina Faso is proving that self-reliance isn't just a dream, it's the future. But how is a small West African nation outpacing its wealthier neighbors in healthcare? And what does this mean for the rest of Africa? The answer will shock you. Here we would like to take a moment and thank you for supporting us and being a valued part of our strong community. And if you are not yet a member, we encourage you to join us and help build an even stronger community together. For decades, African nations have been fed the same narrative. Progress is only possible through Western aid, IMF loans, and foreign investment. Healthcare in particular has always been framed as something Africa cannot handle on its own. Without billions in donations, without Western pharmaceutical giants, without foreign-trained doctors, they say, African nations are helpless. But what if that was a lie? What if a country with a struggling economy, security challenges, and limited resources could prove that Africa doesn't need to beg? Enter Burkina Faso. Under the leadership of Captain Ibrahim Traoré, this West African nation is rewriting history. Instead of waiting for Western assistance, instead of tying itself to predatory loans, Burkina Faso is proving that a self-sufficient, world-class healthcare system is not only possible, but already in the making. This is not just about medicine. This is about a revolution. It's about changing the way Africa sees itself. It's about rejecting the idea that the West must always play savior. While other African nations remain locked in dependency, Burkina Faso is showing the way forward. One hospital, one clinic, and one doctor at a time. The question is, how are they doing it? And more importantly, what does this mean for Africa's future? Let's break it down. Heart disease has been quietly killing millions of Africans for decades, yet it remains one of the most overlooked health crises on the continent. Unlike infectious diseases such as malaria, HIV, or Ebola, heart disease doesn't generate dramatic headlines or urgent international funding. It doesn't create the kind of instant global panic that a viral outbreak does, and it doesn't come with the same emotional imagery that war or famine can produce. But in terms of raw numbers, it is far deadlier than many of the diseases that get widespread attention. Here's the hard truth. Cardiovascular diseases are now the leading cause of death in Africa, responsible for nearly 1.2 million deaths every year. That's more than malaria and tuberculosis combined. Yet most African healthcare systems are still structured around infectious diseases, with very few resources allocated to treating and preventing heart-related illnesses. A 2021 study published in The Lancet revealed that over 5% of Africa's adult population is at high risk of heart disease, yet only a fraction receive adequate medical care. The reasons are clear. Specialized heart hospitals are rare, advanced treatments are expensive, and most doctors are not trained to handle complex cardiovascular cases. Unlike in wealthier countries where routine heart screenings are standard practice, many African citizens do not get diagnosed until their condition has reached a critical stage. By the time they seek help, it's often too late, and the numbers are only getting worse. According to the World Health Organization (WHO), deaths from heart disease in Africa have increased by over 50% in the last 2 decades. This is due to a mix of poor diets, lack of exercise, rising stress levels, and increasing urbanization. As cities grow, so does the consumption of processed foods high in sugar and unhealthy fats, leading to a surge in conditions like high blood pressure, diabetes, and obesity, all major risk factors for heart disease. Even when a person is diagnosed, access to treatment remains a nightmare. In countries like Nigeria, Kenya, and South Africa, a single heart bypass surgery can cost between $10,000 and $50,000. That's an impossible sum for most African families, where the average income is often less than $2,000 per year. The lack of affordable cardiac care means that only the wealthiest Africans can afford life-saving surgeries, while the vast majority are left to suffer in silence. Here's a reminder to please like and share the video and subscribe to our channel to watch more videos on Black culture, history, civilization, and identity. Let's continue now. Making matters worse, Africa has an extreme shortage of cardiologists. The entire continent has fewer than 500 trained heart specialists, with many countries having fewer than 5 cardiologists serving millions of people. Compare that to the United States, where there are over 30,000 cardiologists for a population of 330 million. In countries like Burundi, Chad, and Sierra Leone, there isn't a single practicing heart specialist. If you develop a serious heart condition in these places, your chances of survival are almost non-existent. The reality is devastating. Millions of Africans are dying from a completely treatable disease. Unlike pandemics that require the invention of new vaccines or experimental treatments, we already know how to prevent and manage heart disease. The problem is that Africa has been systematically denied the resources to do so. This is why Burkina Faso's decision to build Africa's most advanced heart institute, without Western loans, is nothing short of revolutionary. Instead of accepting the status quo, Burkina Faso is proving that African nations can take control of their healthcare systems and invest in life-saving infrastructure on their terms. This isn't just a hospital, it's a declaration that Africa no longer needs to wait for the West to solve its problems. For decades, the standard response has been predictable. If an African country wants a heart institute, it must wait for a foreign-funded project that takes years to materialize, if it ever does. Burkina Faso decided to reject that approach. Instead of waiting for handouts, it is building Africa's most advanced heart institute, on its terms. This facility is not just a hospital, it's a game changer. The impact is massive. Right now, in countries like Nigeria, Ghana, and even South Africa, heart surgery costs anywhere from $10,000 to $50,000. In Burkina Faso, most people make less than $1,000 a year. The math is simple. Without intervention, heart disease is a death sentence for millions. But this institute is designed to change that forever. It's not just about performing surgeries, it's about preventing heart disease before it reaches a critical stage. The facility will include preventive care programs, early screening units, and affordable medications that were once out of reach for most citizens. People won't have to wait until they're in critical condition to receive care. Instead, they will be educated, screened, and treated early, saving thousands of lives in the long run. And there's more. This institute is being built as a training ground for Africa's next generation of heart specialists. Instead of relying on expensive foreign doctors, Burkina Faso is investing in its medical students, giving them direct access to cutting-edge cardiology training. The goal is clear: African problems, African solutions. This project alone shatters a dangerous myth: the idea that Africa cannot build world-class medical institutions without Western help. Burkina Faso is proving that narrative wrong. At first glance, it might seem like Burkina Faso is just following a well-worn path. After all, hospitals exist across Africa. Major cities like Lagos, Nairobi, Johannesburg, and Accra all boast modern medical facilities, highly trained doctors, and advanced technology. Even smaller nations have seen investment in healthcare infrastructure over the years. So, why was it so important for Burkina Faso to build its world-class hospital? Why not just rely on existing regional hospitals or partnerships with neighboring countries? The answer lies in a brutal and often overlooked truth. It's not just about having hospitals, it's about who can access them and how quickly. The greatest tragedy in African healthcare isn't just the lack of hospitals, it's the distance between them. Millions of Africans don't live in capital cities where well-equipped hospitals are concentrated. They live in rural villages, remote towns, and vast countryside areas where the nearest medical center could be hundreds of kilometers away.
During the recent fighting, the rebels came to our village and we fled into the bush. When we were hiding in the forest, the hospital was looted and all drugs stolen. Now we have no place to go when we are sick.
Today, an MSF team is in the village. Sebastian thinks he has malaria, so he's come to be tested.
The test is positive.
For most of these people, getting sick isn't just a medical emergency, it's a logistical nightmare. Imagine a pregnant woman experiencing complications in a village 100 kilometers away from the nearest maternity ward. There are no ambulances. Public transportation is unreliable. She must either walk, find a motorcycle taxi, or wait for a family member with a car to drive her. Hours later, if she makes it in time, the hospital may already be overwhelmed, understaffed, or lacking the equipment needed to save her life. This isn't just a hypothetical scenario. Every day, thousands of people across Africa die. Not because their illnesses are untreatable, but because they simply can't get to a doctor in time. This is precisely why Burkina Faso refused to rely on regional hospitals alone. Unlike many other African nations that only focus on upgrading capital city hospitals, Burkina Faso has taken a nationwide approach. Instead of just building a hospital in one location and expecting people to come to it, the government has developed an interconnected healthcare system designed to bring care closer to the people. First, by building the Bobo Reference Hospital, Burkina Faso ensured that top-tier medical services were no longer limited to the capital. Most African countries have a single, overburdened national hospital in their capital city. Burkina Faso chose decentralization, placing its most advanced hospital in Bobo Dioulasso, the second-largest city, to distribute healthcare access more evenly. Second, the country launched an aggressive hospital expansion plan, committing to 55 new regional medical centers to ensure rural populations no longer need to travel for hours just to see a doctor. Third, mobile clinics were introduced to reach areas where even regional hospitals are still too far away. Instead of forcing villagers to travel to the nearest facility, these fully equipped medical units travel directly to communities. The key difference between Burkina Faso's approach and that of many other African nations is that it is not simply adding another hospital to the map, it's fixing the entire system. For comparison, let's look at Nigeria, Africa's largest economy. Lagos has some of the most advanced hospitals on the continent, with world-class equipment, cutting-edge research facilities, and internationally trained specialists. Yet, in the northern and rural regions of the country, millions of people lack access to even basic health care. A person in a village outside Kano might have to travel 6 hours just to find a hospital that can run a simple blood test. This isn't an issue of technology, it's an issue of geographical access. South Africa faces a similar problem. While Johannesburg and Cape Town have top-tier hospitals, vast areas in Limpopo, Eastern Cape, and rural KwaZulu-Natal struggle with severe doctor shortages and long travel distances. Patients in these areas still die from preventable diseases simply because they can't reach a medical facility in time. Burkina Faso learned from these mistakes and is ensuring that its hospitals are positioned where they are needed most. The government isn't just saying, "We have a modern hospital." They are saying, "We are making healthcare available to everyone, no matter where they live." Another reason Burkina Faso needed its hospital system is the problem of medical tourism. For years, African elites have flown abroad for healthcare, to Europe, the US, or even India. This drains national wealth and reinforces a dangerous cycle of dependence. If African leaders, business tycoons, and wealthy citizens don't invest in their hospitals, then who will? Burkina Faso's approach is different. Instead of watching millions of dollars leave the country every year for foreign medical care, the government is investing in local hospitals that will serve all Burkinabe, not just the rich. Building a world-class hospital wasn't just about medical treatment. It was about making a bold statement. Burkina Faso will no longer wait for foreign donors. It will no longer force its people to travel abroad. It will no longer accept a system where only the rich have access to healthcare. This is a new model for African healthcare, one that other nations may soon have no choice but to follow. The impact has been monumental. Since launching, Burkina Faso's mobile clinics have provided healthcare access to over 3 million people who previously had none. The number of women receiving cervical cancer screenings has tripled. The infant mortality rate in rural areas has dropped. But perhaps the most powerful thing about these clinics is that they are permanent. In many African countries, mobile clinics operate only as long as foreign donors provide funding. The moment an NGO pulls out, the service collapses. Burkina Faso, however, has fully integrated mobile healthcare into its national healthcare strategy. This means the clinics will continue to operate no matter what happens with international funding. This is what real healthcare independence looks like. So we are not just talking about the heart hospital Traoré built, But he has done more than that. And where does this take Africa? With its state-funded, self-reliant healthcare revolution, Burkina Faso is proving that an African country can build modern hospitals, train its doctors, and provide cutting-edge medical treatments without a single dollar of Western aid. This challenges one of the biggest lies Africa has been told, that it is too poor to develop on its own. If a country like Burkina Faso, facing economic difficulties and security challenges, can make these investments, then why can't wealthier African nations? This hospital, along with the 55 medical centers Traoré is building, takes Africa into a new era. An era where African nations can stop begging for medical aid and start leading in medical innovation. One of the most powerful impacts of this movement is the shift in mindset it is creating among young African professionals. For decades, Africa has suffered from a severe brain drain in the healthcare sector. Highly skilled doctors, surgeons, and medical researchers have left Africa for Europe and the US because their home countries could not offer them the infrastructure, salaries, or research opportunities they deserved. Burkina Faso's decision to invest in world-class healthcare could reverse this trend. The new heart hospital and Traoré's broader medical expansion mean that African doctors no longer have to leave to find success. Instead, they can stay and build the future of African medicine from within. This changes the entire equation for African medical students, who can now see a real career path in their home countries instead of being forced to work abroad. Beyond retaining talent, this movement is also putting Africa on the global medical map. Right now, when people think of medical tourism, they think of destinations like India, Thailand, and Singapore, which attract patients from around the world due to their affordable, high-quality healthcare. But what if Africa became the next medical tourism hub? Burkina Faso is laying the foundation for this future. If a high-quality heart institute in Burkina Faso can offer treatment at a fraction of the price of Western hospitals, then why shouldn't people from across Africa, and even beyond, come here for care? Instead of wealthy Africans spending billions of dollars every year in European hospitals, they could invest in their own continent's medical industry. This shift would not only keep African wealth within Africa, but it would also accelerate medical innovation and research within the continent. Right now, most of the cutting-edge medical research and development happens in Europe and North America. But what if Africa began producing its groundbreaking medical advancements? Burkina Faso's hospitals aren't just about healthcare. They are about economic empowerment. They create jobs for doctors, nurses, researchers, engineers, and medical equipment manufacturers. They stimulate local pharmaceutical production, reducing Africa's dependence on Western drug companies that charge exorbitant prices. They provide education and training for the next generation of African medical pioneers. If this model spreads across the continent, Africa could move from being a recipient of foreign aid to becoming a global leader in medical innovation. Countries like Ghana, Tanzania, and Angola are already watching Burkina Faso closely. And if this strategy succeeds, others will follow. Traoré isn't just building hospitals. He is laying the groundwork for an Africa that controls its future. A future where African leaders don't wait for Western approval to invest in their people. A future where African doctors don't leave but lead. A future where African nations are known for their medical advancements, not their medical crises. This isn't just about one country building a hospital. This is about Africa proving that it can stand on its own. Do you think more nations should follow Traoré's path? What will happen next? Let us know in the comments section where you see Africa going if it keeps progressing like this. Do you want to watch more videos like this one? If so, subscribe to our channel and press the bell icon next to it. We have decided to bring videos on something nobody talks about: the Black culture, civilization, history, and evidence about how glorious Blacks have been. Thanks for watching, and until the next video, stay tuned.